Hello everyone. Welcome back to our channel. Today, we have a fascinating topic to discuss. We are going to explore some incredible tricks in mnemonics to remember about nephrolithiasis, renal stones, commonly known as kidney stones. These small, hard mineral and salt deposits can cause significant pain and discomfort. Join me as we explore the causes, symptoms, and potential treatments for renal stones, shedding light on this common yet often misunderstood medical condition. If you're curious about how these stones form and impact our health, you're in the right place. So, let's get started. Here are some simple tricks to remember the causes of kidney stones. The mnemonic goes as I'm hot door. I am, as immobilization and infection. Hot climates. D. Diet rich in calcium. O. Organisms, E. coli, streptococcus. O. Obstruction to urine flow. R. Randall's plague. Let's go to the types of stones. 1. Calcium oxalate stones 75%. 2. Uric acid stones 5%. 3. Phosphate stones 15%. 4. Cystine stones 2%. 1. Calcium oxalate stones are the most common types of stones. They are envelope shaped as you receive and send the mail all the time. Due to sharp projections produces hematuria, resulting in deposition of blood over the stone giving a dark brown color. It's radio-opaque. 2. Uric acid stones. They are rhomboid in shape. As you write a wide U, you will get a rhomboid shape. Occurs in acid K urine. Multiple, small, hard, yellow-colored. Stone. Pure acid stones are radiolucent. 3. Phosphate stones or triple phosphate stones. Remember it is iPhone's triple camera as shown in picture, calcium, ammonium and magnesium. These stones are really bad, hence shape as coffin lid shape. Commonly occurs in renal pelvis and tends to grow in alkaline urine. Let's go to 4. Cystine stones. They are hexagonal in shape. How do I remember it? Cis looks like 6, so hexagonal in shape. It occurs in young girls at puberty. Commonly found in cystinuria. Clinical features. Renal pain, dull aching to pricking type of pain posteriorly in the renal angle formed by the sacrospinalis and 12th rib. Murphy's kidney punch test demonstrates tenderness at renal angle. The same pain may sometimes be felt anteriorly in the costal margin. Hence, it is described as costovertebral pain. Nausea and vomiting is due to intense sympathetic stimulation caused by stretching of renal capsule mediated by celiac plexus. Ureteric colic. When the stone is impacted in the pelviureteric junction or anywhere in the ureter, it results in severe colicky pain originating at the loin and radiating to the groin, testicles, vulva and medial side of the thigh. This may be associated with strangury. The referred pain is due to imitation of the genitofemoral nerve. Hematuria. It is common with renal stone because the majority of stones are oxalate stones. The quantity of blood lost is small but it is fresh blood. Recurrent UTI, fever with chills and rigors, burning micturition, pyuria may occur along with increased frequency of micturition. Investigations. 1. Blood urea and creatinine to rule out renal failure. 2. Plain X-ray KUB. To diagnose stones. 90% of the renal stones are radio-opaque. Enlarged renal shadow can be seen. 3. USG. Presence of the stone can be diagnosis. Exact size and location of the stone can be evaluated. 4. IVP. To locate the stone exactly in relation to kidney and ureter and to assess renal function. A non-radiopaque stone can be seen as a filling defect. Hydronephrosis and hydronephroterosis can also be seen. Now non-contrast CT scan and contrast CT scan are used for more accurate detection of causes of abdominal colic. Treatment. The treatment of renal stones can be divided into non-operative treatment and operative treatment. Non-operative includes conservative and extracorporeal shock wave lithotripsy ESWL. And operative includes endoscopic procedures, open procedures, and special situations. 1. Non-operative treatment. First, conservative, small stones less than 5 mm in size pass off with intake of copious amount of fluids and at times forced diuretics. Intravenous hydration followed by intravenous furosemide may help pass the stones spontaneously. Second, extracorporeal shock wave lithotripsy ESWL. After cystoscopy, a ureteric stent, double J stent, is placed into the ureter on the side of a large renal stone. Shock waves are generated around 500 shock waves which blast the stone. The stones get crushed and most of the stones will come out by the side of the stent. Small stones can be removed without prior crushing. Operative procedures. 1. Endoscopic procedure. PCNL, percutaneous nephroorthotomy. Percutaneous nephrolithotomy (PCNL) retrograde pyelography (RGP) is done when the stone is located in the pelvis of the kidney. With a small IM incision in the 3. loin, the PCN needle is passed into the pelvis of the kidney A and is confirmed by fluoroscopy. A guide wire is passed through the needle into the pelvis of the kidney. The needle is withdrawn, with the guide wire left within the pelvis. B. Dilators are passed over the guide wire and a working sheath is introduced into the pelvis. A nephroscope is passed into the pelvis and if the stone is small, it can be taken out. If it is big, it may have to be crushed using ultrasound probes and the fragments are removed. Complications of PCNL. Injury to the colon. Sepsis. Injury to the blood vessels. Urinary leak may persist for a few days. 2. Open surgical procedures. Depending upon the location of the stone, various types of procedures are done. They are as follows. Pyelolithotomy, when there is extra-renal pelvis. Nephrolithotomy, when there is intra-renal pelvis, the stone has to be taken out through the kidney parenchyma. Extended pyelolithotomy, by retracting the kidney parenchyma laterally, the incision over the pelvis can be extended over to the calyx and the stone can be extracted from the calyx. Even a large staghorn calculus can thus be removed. Pyelonephrolithotomy, stone is extracted through an incision in the pelvis as well as the renal parenchyma. Partial nephrectomy, when the stone from a lowermost calyx is impacted, a lower pole nephrectomy can be done. By the end of this video, you'll have these short tricks locked in your memory, making renal calculi a piece of cake. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more educational content. Thanks for joining us. Stay tuned for more educational content and stay connected with us on social media. See you in the next video.